So I get a lot of questions about, what's next? What am I thinking about next? What are our plans in the future? And I've been thinking a lot about this for several years. And even after COVID, a lot of things that were back burner came to front burner as business got disrupted and things changed. We have different aspects of our business. And one is, looking and feeling better on the outside. But what about on the inside? What can we do to look and feel better on the inside? Look better, feel better. Maybe not along conventional healthcare. And I don't want to badmouth healthcare, but it really is disease management. And healthcare might be, you might think about going to the gym as healthcare, going and getting plant-based foods as healthcare, meditating as healthcare, but your insurance isn't paying for that. And I think there's a lot of people that would like to know what they can do outside of traditional healthcare to preserve a longer period of life. And the reality is that right now, technology knows how to make us live longer with a longer health span. So not just be old people, but actually have more youth, and it's coming. So if you don't screw it up in the next 5 years and die, your ability to live longer, healthier life is coming. And I've been studying this for years. I'm in a couple mastermind groups where we talk to scientists about this, and I'm looking at the services we're going to offer to start dabbling into that. But one is looking at what are the 3 or 4 things that people are likely to die from unexpectedly or prematurely, or have a premature effect on their happiness and longevity and health span. Number one is cardiovascular disease. And in modern medicine, when do we detect cardiovascular disease? When you have a heart attack, okay, or a stroke. And how do they prevent it? Well, they check your cholesterol, which is pretty much a useless predictor of who's going to have a heart attack. And we put people on drugs, statins, or blood pressure medicines to reduce that risk. We try to lower their diabetes. But what happens if you can detect if you're the person that's going to have the heart attack a decade in advance with some degree of precision? Would you do it? Okay, I would, and I've done it. And there's really 2 technologies that predict whether or not you're going to have a heart attack, and we can actually very accurately predict your risk of cardiovascular events compared to your peers. One's called a calcium score on a CAT scan. I don't like that test as much because it uses ionizing radiation, and you can't see changes over time. That's a good one. It's cheap. It's about $90. Another one's called a carotid intimal media thickness, and this we use an ultrasound on your carotid artery, and we predict the age of the rest of the vessels in your entire body and accurately predict whether or not you are at risk for a heart attack or not. Way more precision than checking a cholesterol test, and way more predictable way more ability to check whether or not you're doing activities that can make it shrink. So we measure the thickness of what's called the intima. There's an artery and it's got a wall, and the thickness of the wall predicts your cardiovascular age. And if you're 50 and you've got the artery lining of a 60-year-old, you really got to do something because a heart attack is coming, okay? And we can actually see if that's getting better based on the activities that you undertake, which could be taking medications or lifestyle changes. So I think that's very important. Number 2, and we can all kind of take a moment and pause and think about this. We've all known somebody that found that they had cancer when it was too late to take care of it. Ovarian cancer, pancreatic cancer, esophageal cancer. I've known people that died from every one of those conditions, and they picked it up when it was too late, okay? I know that I have no cancers because I get a whole body MRI. There was a time that it really wasn't practical because the studies were not that good, but looking at certain organs, we can do an MRI of the full body, see whether or not we have existing pancreatic cancer, ovarian cancer, uterine cancer, liver cancer, esophageal cancer, sarcomas. We can pick up certain diseases way before they're at the advanced stage where you're symptomatic and now you catch it and you're going to die. So I think that's important that you do that on your own. Your insurance company's not going to pay for that. It shouldn't be very expensive. I've done it a couple times in my life. And for example, like prostate cancer is a concern for everybody, certainly every man. And I did a 3D prostate MRI and there's nothing there, so I don't have to worry about getting a rectal exam or getting a PSA test. I'm not going to bother with it because I don't have any cancer. Way more accurate than these tests that insurance pay for. And there was actually a recent U.S. task force that looked at the PSA tests, and they found they were pretty useless for reducing mortality in people overall. So we're doing these tests that are ingrained in healthcare, but they're not really doing much to offset the likelihood of people dying from prostate cancer. So that's like an important point. We're still doing them, but it's like doesn't really change the needle very much. So what happens if we do that? What happens if we can predict whether or not you're the person that's going to get neurocognitive decline, Alzheimer's, dementia? It wouldn't be great to live a long time if you wound up being incapacitated from dementia. We can actually measure your genes and whether or not you're at risk for it We can also measure the size of your hippocampus with very much accuracy, a part of your brain that degenerates when we get neurocognitive decline, and we can actually reverse it. So personally, in 2018, I went and got a 3 Tesla MRI of my hippocampus in San Diego at Health Nucleus, and I measured my hippocampus, which was 9.18 cubic centimeters, so that's a certain size. And the ventricle had a certain size as well, 1.25 cubic centimeters. And I did a certain activity for 1 year and remeasured on the same machine, same city, same group, and my hippocampus had grown from 9.18 to 11.25. It grew up by about 20%. The hippocampus, which is the memory thinking part of your brain. And the ventricle, which is the dead space, the area that's just like dead space, went from 1.25 down to 0.25. So it's like a child's hippocampus, it's like a child's brain now. So I've anti-aged my brain. What happens if you could see that you had decline and fix it and alter it? Would you do it? Would you do it? And the third thing is genetic testing. That's right now a little bit muddy because if you go to 10 different labs, you might get different results. Sometimes they're very confusing. So I'm really working on finding a very simple, inexpensive way to do genetic testing to see what you're at most risk for, so you can hone in on that. And the last thing is, what's your genetic age? How do we know what that is? Well, the method we had before was called measuring your telomeres. These are little chains on the end of your DNA, and over time, they shorten. It's kind of a crude way to measure age, but it's something that we've used for years that's on average okay. But just recently, we understand there's a very accurate way to genetically age somebody and kind of, unfortunately, predict death or reverse your age. And the first big study was called the Horvath clock, where they measure methylation on the DNA. But since that time, there's been multiple different labs that will measure your DNA age very accurately. Basically, as you age, your DNA gets damage to it. And we can measure the damage, compare it to your peers, and see, are you older than your known age genetically, or are you younger? What can you do to set the clock back? And it's actually happened in human beings. So there's a study published by Dr. Fahey, 2019 September, where he took 60-year-old men and put them on a certain well-known FDA-approved drug combination. They were off-label uses for a 6-month period. And he measured their genetic age at the start of the study, and he had them take the drug intervention, which are known to be safe drugs, for 6 months, and remeasured their age a year later. So started in day 1, drugs for 6 months, well-known drugs, safe, measured their age a year later, and they were actually a year and a half younger than the day they started. They de-aged by 2.5 years. Okay, these things are coming. There's also things called, there's a concept called senescence of our cells. So senescence is kind of a programmed self-destruction, and this seems to be the basis of aging. We used to think it was all inflammation, but it's probably not. Inflammation plays a role, but it's senescent. And our cells have the ability to replace themselves indefinitely. Okay, so theoretically, a cell line could live forever and be healthy. But something happens, and there's a peptide called mTOR, and when that's activated, these cells become senescent, means they kind of become zombie cells or cells that will no longer replicate and they will not die. And those are senescent cells. And once they become senescent and they will not replicate or replace themselves and they won't die, they become old. And they poison other cells around them to join their club and become old cells that will not die or replace themselves. Well, there's a process called autophagy where your body gets rid of senescent cells. And it only occurs, surprisingly, when we starve. That's the only time it occurs, is when we starve. And getting people to starve themselves is hard. Intermittent fasting refers not eating for 2 days. If you don't eat for 2 days, you will go through autophagy and you will clean up those dead cells. But they have drugs they call fasting mimetics. So these are drugs that reproduce environments of fasting without actually fasting. A classic one would be metformin, a drug commonly used for diabetes, that has been shown to actually reverse age to some degree on people who are overweight or obese or have certain cancers. They're doing a study right now, a long-term study, on just putting normal, healthy people on metformin and see if they live longer. That's going to take a long time for us to tell, and we don't know yet. So I'm not recommending you take metformin, but it is being studied for that. But there's a few other drugs that have been studied. They're already FDA approved for other uses that have an impact on this senescence and allow animals to anti-age, and are doing studies on humans right now. So this is coming. A common one you'll hear about in the future is called rapamycin. So rapamycin is a compound that was found on Easter Island in the 70s. And they used it at first for kidney transplant patients for immunosuppression so they'd maintain the kidney. So it had some effect on the immune system. But they've studied it in, it has multiple uses. It's being used for other things as well, but it seems to help our body repair itself and go through tissue remodeling and tissue regrowth. So it's being studied now in humans for anti-aging. They already studied it in dogs. They found that they just two studies on dogs with rapamycin. They gave dogs who were kind of close to dying rapamycin, and they weren't real scientific about it in terms of the parameters, but they measured a little more active, a little more puppy-like. They got a little more energy, and it was done safely. And they've done a few other human studies as well, mostly animal studies, however, and rapamycin clearly turns back the clock in mice if done in a certain fashion. There's a way to do it, so don't go out and buy rapamycin, ask your doctor to give it to you. They won't yet, it's not ready yet. And there's a couple other drugs I'm not going to really get into now that are being studied for different conditions. There's quercetin is a vitamin that does seem to have a fasting mimetic. There's another called fenestin that does the same thing. And there's another drug we use for a chemotherapy agent that seems to have a potent senolytic effect. And they've done experiments on human beings where they took people that were going to die anyways, and I hate to say that, but idiopathic pulmonary fibrosis is a condition where the lung cells become senescent. So lungs all want to die, and we don't know why it happens. That's why I call it idiopathic, and they universally die usually about 3 years. And they put people on this combination of the two drugs, and their lung function seemed to get better. They had more energy. They did it on patients that had diabetic kidney disease, and they found that they seem to have some anti-aging effects. Right now they're doing study on older women that don't have any specific disease to see if they actually get younger. So these things are coming. I think step number one is diagnosis. Do you have a condition that can maybe be reversed or caught early? Cancer, neurocognitive decline, cardiovascular disease. And if you keep yourself healthy long enough until these studies on humans are done and we know they're safe, is there drug therapy that can actually precisely turn back your own clock, make yourself younger? So I'm talking about the CIMT study, the carotid study for patients that are maybe over 40 to see if they're at risk. Full body MRI looking for solid tumor cancers. It wouldn't pick up like colon cancer or skin cancer. You still got to see your doctor. They probably still do a mammogram, but the solid tissue or cancers. Genetic testing for common genetic diseases, measuring your hippocampus, and then measuring your age, your genetic age, either with telomeres or doing the Horvath clock or a similar DNA methylation study. And then working on having that baseline to reverse things and extend your period of healthiness. When I talk to patients about this, they imagine living in a nursing home longer, and I'm not talking about that. I'm talking about what happens if you can be 100 years old and feel exactly like you do today when you're healthy. Are you ready to die then? Probably not. Probably not. And that time is coming. How's that?
Good. It's a lot of interesting things. I feel like it reminds me of like those YouTube videos that are, future forward.
Mm-hmm.
Here's,
Yeah,
here's
that
what
could
it'll
be a
look
whole
like.
different video that
Yeah.
could open up a whole new audience and just get a lot more interest in these new procedures coming.
Yeah, it's like I've been thinking about it for a while and sort of doing the research on it, and just never did it because the veins were